And am I host now because I can't see I have the option for share. Yeah, I have it here, I think.
Uh,
Send request. I send the request just to.
You can start, yes.
okay. So I'm going to share. Um, can you all see the slides?
Yeah.
Okay. So my name is Hisham Ibrahim. I'm one of the respiratory consultant in Cork University Hospital. Thanks SDUI for organizing this session. This is the slides kind of highlight the roadmap to becoming a world-class physicians in Ireland and practice as a respiratory consultant. I will give you a brief kind of backgrounds, 2 or 3 slides before I hand you over to my colleagues to discuss the different steps in the training Ireland, including the basic specialty training, the higher specialty training, the post-CCSD fellowship trainings, and we will also briefly highlight the alternative pathway to register as specialist here in Ireland. So the training body in Ireland this is the structures of the training body in Ireland. So the training body is the Royal College of Physicians of Ireland. This is equivalent to the Sudan medical specialization boards. Under the umbrella of the Royal College of Physicians of Ireland, there is different faculties and institutes, including the Faculty of Public Health, Faculty of Pathology, Faculty of Pediatrics, the Institute of Obstetricians and Gynecologists, and the Institute of Medicine, which we're all interested in today. So the Institute of Medicine was established in 2020. It replaced the ICHMT, which is the Irish Committee on Higher Medical Educations, as a training body that oversees the training of 19 different specialties in medicine here in the islands. It's accredited by the Medical Council of Ireland as a national training body of medicine. And the training program are designed not just to help your clinical skills or to develop your clinical skills, but also to enhance your communications, management, and interpersonal skill that you need to deliver world-class patient care. So the Institute of Medicine is accredited, as I said, by the Medical Council and meet the strict criteria required to deliver postgraduate specialist training in 19 different specialties as listed in the slides, including cardiology, dermatology, gastroenterology, general internal medicine, neurology, nephrology, respiratory medicine, and rheumatology, but to name a few. Going back to our roadmap, if you decide to pursue down the training pathway in Ireland, the first training post you'll apply for is the basic specialty training. And I'll hand you over to my colleague, Dr. Mohamed Elhafiz, who is a BST trainee in Mater Hospital to discuss the basic specialty training in Ireland. So Dr. Elhafiz graduated from the University of Medical Science and Technology in Sudan, where he completed his internship training before moving to Ireland, where he rotated in different specialties in general internal medicine, as SHO and a registrar. In his last job, he worked as a registrar in the acute medical assistance unit here in Cork University Hospital, while completing a postgraduate certificate in professional medical educations before he's banished from Cork and currently working as a BST trainee in Major Hospital. So Mohamed, the floor is yours.
Thank you, Dr. Hisham. It's a pleasure to be here and share this presentation with everyone.
I'm gonna stop sharing
start
here.
by, yeah, I hope this is clear for everyone.
It's clear, yeah.
Good. I try to give a brief presentation about the BST program. It's a hospital-based training program that form the first footstep toward the HST and the roadmap to becoming a consultant in Ireland. It's a 2-year program.
Sorry, Mohamed, if anyone not speaking, if you could mute your mic, please.
So it's a 2 years program. You work as an SHO during the post. You have a rotation every 3 months with a total of 8 rotations. Rotating between different specialities. You have to go through at least 3 out of 5 core specialities. These 5 core specialities are the cardiology, the respiratory, the gastroenterology, the endocrinology, and the geriatric medicine. You also have to go through a 1-year minimum where you're working with teams that have general internal medicine and selected take to ensure that you have good experience in general medicine. If you're selected, there is 9 hubs in Ireland, 9 groups of hospital, if you may say. You're going to be requested to put these hubs and put preferences to which hub you want to join. So it might be handy to know more information about these hubs. These hubs could include the 4 hubs in Dublin, St. James, Tala Group, St. Vincent University Hospital, Beaumont Hospital and Connolly Hospital Group, the Mater Group. There's also Galway, the South, including Cork and Mercy, the Southeast, including Waterford and Clonmel Hospital, the Midwest, including Limerick, and lastly, Mayo and Sligo Group. One of the main thing that you should know about these groups that, for example, the Mater and Galway are the only centers or hubs that provide US rotations. There is a selection process, but if you're working in one of those two schemes, you might have a chance to spend 6 months in the US. Obviously, with the current status and the visa requirement, it might be a bit complicated.
Mohamed, sorry for interruption. Mohamed, sorry for interruption. Are you sharing your slides? I can't see the slides. Is it just me? I don't think you're sharing the slides.
I think it's clear.
Okay. Okay, you can carry on.
So there's also within those 2 years of the BSc training, there has to be 6 months that are going to be spent outside the main metropolitan area, outside the main city in a smaller hospital. So the training requirement, there is a mandatory that you're getting up to date with these courses. There is every quarter there is a tutorial. It's a mandatory. It's part of the training. If you haven't finished it, you wouldn't be signed off. You also have to maintain your e-portfolio, including all the skills that you have gained, all the activities you have done. There is requirement more specified during within the portfolio, including covering calls, doing procedures like ABG, doing LPs or different type of procedures. It's all specified very clearly in the portfolio. You have to make sure that you fill your portfolio and do your assessment. There's an end of post review. There's also quarterly and annual evaluation. It's very important to update your e-portfolio and have your mandatory courses. And the last bit that you have to make sure that you have is finishing your exams, the MRCPI, part 1, part 2. Part 2 consists of the um, both the clinical and the knowledge part, the paper. This is just a revision of what we have just said. In order to get your BST certificate, you have to go through your 24-month post. It has to be in the approved areas. More than 3 core specialities have been covered. You have to have the required experience. There is a certain number of clinics and core activities that you have to participate in. You have to make sure that your e-portfolio is filled, signed off, and you have attended all the required study days. Recently enough, most of these study days are done virtually, meaning that the sessions are carried out through online meetings. So that's more handy. And you have to know that these are mandatory, so you are allowed and entitled for study leaves for these sessions and activities. And you have to make sure that you have passed your MRCPI exams. So why is the PhD important? It's first for all, it's required for most of the HST programs. It's very important to have your BST certificate before applying for cardiology and endocrinology and other HST programs. Without the BST certificate, your application wouldn't be accepted. The BST also improve your experience. It makes sure that you have the required core clinical knowledge. It enables professional development and ensure safe and standardized patient care. So when we say that the BST allows you to apply for the HST, we're talking about more than 16 program, 16 different specialities, including the cardiology, the pharmacology and therapeutic, clinical genetic dermatology, infectious disease, all these programs. Some programs down the bottom here might not necessarily require you to go through the BST, but it's very important and very handy to have the BST done. But that could include hematology, microbiology, public health medicine, chemical pathology, and radiology. So what are the entry requirements to this training program? The basic stuff, you have to have your medical degree, you have to have your internship completed, you have to have an IMC registration. You also need to show English proficiency, either IELTS or OET exams. And when you do apply, there's going to be whether you are an EU citizen or a stamp 4 would have a weight on your application and shortlisting. Now, it's very important when applying to make sure that you have submitted all the documents. It's a very simple mistake, but it could cost you greatly. Many people come in after finishing the application period, mentioning that they haven't submitted some documents and they miss that application period because of that. So you have to double check about all the documents, making sure they're sent and received. You apply online through the RCPI, you submit your academic transcript, your centile, during the college time. You also send your CV. If you have any evidence of research, audits, qualification, all this make a change. It will affect your final marking and your shortlisting. When we talk about the marking and the scoring system for the BST, the first step, and it's very important because it has a maximum point of 20 points, which is a great deal. It's the ranking in the class or the percentile from the medical school. So 20 mark is a huge part of the marking system. If you lose 20 mark from the start, you're starting with a step behind everyone. If you're ranked within the first 10% of your class within college, that's full mark, 20 mark. And then, as you can see on the table here, it's clear that your point decrease as your ranking in the class. If you haven't submitted any documentation to suggest that percentile, you might be given 0 mark. Sometimes if you're providing a document that indicate that there's no ranking system, because this is a common issue in some of the universities in Sudan, that they don't have this ranking system. So the best thing to do is to have a documentation from that university to show that there is no ranking system. But even in that case, you're only going to be you're going to end up with 4 marks. So you're losing 16 point. That's in the first step. So it's always better to contact your university to try to have a ranking system in place, to try and see if they're able to give an equivalence of your ranking in that university. It would be very, very helpful, and it will affect your BST application. There's other areas that are very important and also count within the training application, including the research. If you have any masters, if you have any PhD, if you have any application, you don't have to be the first authors in all these publications, research audits. Even if you're a second author, you're a third author, it will count. Obviously, if you're the first author, it will count more, you're giving more mark. If you have anything that has been published anywhere on a national and international, or even in a small gathering, last year, for example, when we did the SDUI symposium, that would count as an international symposium. If you have applied and you have any posters, you have any audits in the SDUI, that would count greatly and would have marking for you in your favor. The audits, the teaching, it all counts. Going back to the SDUI again, it could also help in working as a leadership point. It's very important. They love and ask about these activities in the interview. From my personal experience, they spend third of that interview for the PhD just talking about the SDUI or other activities that shows leadership. The interview is the final part of the application or the selection part for the PhD. It lasts 15 to 20 minutes. The panel would have 2 consultants. They usually try to assess your clinical judgment, your communication, your ethical reasoning, and the suitability for training. They would start by asking 2 questions. The first one is usually a very clear, detailed clinical question. For example, a patient coming to the ED with a septic shock or history suggestive of a septic shock, for example. And just to see what's your approach to this patient and how you're gonna approach him, and they'll give a management plan. The second panel question or the second question in the interview would usually have 2 parts, an ethical part or a communication part, to see For example, how would you discuss do not resuscitation status form with a family of a patient who is likely deteriorating? Um, the interview has a huge weight, a great weight in the final score. So it's very important to try to have a good score in the interview. This is an example of the final marking system for the BST application. If you can see that the undergraduate part has a huge part, it's 20 mark. That's one of the biggest areas that you could work on. You could try to contact your university to try to get a ranking system in place. The interview also clearly has a great part. It's more than 50 or 60 mark. The first and second question are 34 marks, so that's very important to go through that. After finishing the application, after finishing the interview, if you're considered appointable, meaning that you have one of the final three mentioned here, an overall score of 60 or a minimum score of 17 on the clinical questions, or minimum score of 7 in the clinical question number 2. If you're appointable, then it's going to be a shortlisting process, or the people with the candidates with the highest score would have greater chance in finding a position. Obviously, it's a very competitive program, so the number of candidates applied usually is higher than the number of positions available. So the BST program is changing. There is talk about few changes that could happen in the next few years. Currently, it's a 2-year program, but that could change within the next few years to 3 years program. It's not clear whether that can start from 2025 or 2026. That change in duration would also include changing the duration of the rotation itself. There is a suggestion that the first year rotations would change from 3 months, like the current scheme, to 6 weeks rotation in the first year to allow exposure to more specialities. Obviously, it's not clear yet. It hasn't finalized yet. There's also change in the responsibility as you progress through your training. You would have a registrar responsibility in the 3rd year that would also come in with the registrar level pay. There is also question about whether you're going to rotate between different hospitals in the first year. They're trying not to rotate in the first year and stay in one hospital, the main hub, in order to give you a great experience before going to preferred center. The main target behind all these changes is to ensure a good training program while trying to reduce the number of standalone posts with no training. Few final tips about the BST. There's more information that I haven't managed to mention here, but try to think of the BST as a step toward your HST. It's not a target in itself, it's a step in the way. Use the BST period to boost your CV, projects, getting to know people, finish your exams as early as possible. Even if you could manage to finish your exams before joining the BST, that would come in very handy. That would allow you more time to engage in activities that could help in the future for your HST application. Join committees. For example, if you're interested in hematology, it could be handy to join a blood transfusion committee. It could be handy to join the RCBI trainee representative in a specific in your hospital or where you're based. The SDUI, for example, is a good um, area that you could work on and try to improve your leadership point and non-clinical skills. Go to annual meetings if you're interested in nephrology. Go to um, their annual symposium and annual conferences. Meet and greet people. Um, Histopathology, go to the lab, speak to them, ask them to show you around. If you're interested in cardiology, do the procedures, spend more time with them, try to get to know them, and try to see if there's any audits, if there's any research projects that could be possible for you to participate in. I hope I didn't take much time of your time. This is the website, the RCPI website. You'd find more information about the BST, the guidelines, and everything else. Thank you.
Thank you, Mohamed, for this very informative talk about the BST. So as you progress through your training, obviously after you finish your BST, you need to apply for your higher specialty training. So moving on, I will introduce you the next speaker, Dr. Mohamed. He is a specialist registrar in general internal medicine and rheumatology. Currently, he's doing his GM here in Portiuncula Hospital in Ballinasloe. He graduated from Sudan, where he finished his internship before joining the Sudan Medical Council Specialization Board as a registrar of internal medicine. He moved to Ireland in 2019, rotated across different specialties in medicine. He completed his specialty training in general internal medicine in Sligo and Galway University Hospital before joining the higher specialty program training in rheumatology and general internal medicine. Today, currently he's doing his second year of higher specialty training in GIM in Portiuncula Hospital. So, Dr. Mohamed, the floor is yours.
Thank you very much for this introduction. I think I have issue with the camera. It's disabled, I think, by the host. If the host can just put the video here. Still there is issue. Yeah, that's perfect.
You want to share your slides as well?
Okay, that's perfect. Good afternoon, everyone, and thank you again, Dr. Hisham, for this introduction, and thank you, everyone, for joining today. It's a real pleasure to be with colleagues, especially fellow Sudanese doctors working here in Ireland. I know many of us share similar journeys, moving through BST, preparing for exams, and thinking the next big step, which is higher specialist training. The aim of this session is to walk you through the HST pathway in Ireland, what it involves, what you need before applying, how to prepare yourself, and practical tips for both the application form and the interview process. My goal is not just to explain the system, but also to share strategies that can help you stand out and succeed. Yeah, I know HST can sometimes feel overwhelming and highly competitive, especially as international graduates, but with right preparation and strategy and persistence, it's absolutely achievable. And many of us here today are proof of that. So here what we will cover, we will start with overview of the HST scheme, then talk about entry requirements and preparation, moved into the application process, and finally focused on the interview and practical advice for the big day. At the end, I will highlight the key take-home messages, and we will have time for questions. So let's begin with the big picture and overview of the HST scheme. So HST scheme is the final crucial step on the path to get the certificate of the satisfactory completion of specialist training. And this certificate, you get it at the end of the training if you're fulfilling all the requirement by the end of the HST period. And usually you start the HST after the BST training. And then with that certificate, then you will be able to register as a specialist in the Irish Medical Council, and even this specialty is internationally recognized. So the HST scheme in Ireland, it's a 4 to 6 year training program completed in a specialist registrar post. And as you can see, it's between 4 to 6 as it depends on the specialty. Like, for example, most of the medical specialties are 5 year of a training, but especially if there's a GIM year. But for example, the cardiology 6 years, and there's some specialties as well, only 4 year. So the HST scheme and the training, you will be rotating through structured rotations across hospitals. And usually every 1 to 2 years, you will be rotating in different hubs and different hospitals to get different experience. Center, sometimes we have a and then during the training, you will be supervised by a trainer and with annual review every year. And as it is a training program, there's like many study days, either specific to your specialty, or if you have the dual certificate with the GIM, you will have a GIM, General Internal Medicine study days. You have to do minimal numbers each year according to the specialty requirements. So that's regarding the HST scheme. And I know already mentioned by my colleagues, Dr. Hisham and Dr. Mohamed, about the Institute of Medicine and the Royal College of Physicians having all these higher specialty these subspecialties. So actually there are about 29 higher specialty training provided by the Institute of Medicine. And as you can see here, the internal medicine, there are 18 specialties, and the upper first here, 8 specialties. They have both GIM as well as so at the end of the training, you will get dual certificate like general internal medicine and the specific specialty. As you can see here, cardiology, endocrinology, respiratory, clinical pharmacology, nephrology, rheumatology, gastro, infectious, and actually as well the geriatric. So there are 9 specialties having dual certificates. So if you're thinking that you prefer to have like some GIM, to be a GIM consultant as well, at the end you can think about these specialties. And again, these the public health, obs and gynae, occupational pediatrics, and the pathology here. There are 6 subspecialties, including hematology, histopathology, immunology, and as well as chemical pathology, clinical microbiology, and neuropathology. And just to mention again, if you're doing the dual certificate, you have, like let's say I'm doing now the rheumatology, which is a dual certificate with the general internal medicine and it's a 5-year training actually. And now you have to do by the 1st or 2nd year, a full year of GIM, general medicine year, and you have to fulfill all the criteria requirements for the general medicine. So at the moment I did my 1st year in Galway, and this is the 2nd year, which is a general medicine year in Portiuncula. That's why you have to fulfill it. Then after we spoke about the Institute of Medicine and the HST scheme, then we need to know how you can be eligible to start the HST. So the main thing, you need to have successfully completed the BST training. So most of the time there are 2 scenarios. Either you've already completed the BST training by July this year, and now you're working, for example, as a standalone reg, and you fulfilling all the requirement for the BST with the exams, then as the HST application will be starting soon, then you have to have the certificate with you, and then you will be able to apply for it. And then the second scenario is that now currently you're in the second year of the BST, and this is the 3 month, you've been 3 months in the second year, and you planning to apply now, then you will be able to start the HST straight away after the BST if you're successful in the HST application. But the main trick that you have to finish all your membership exams before the HST interview date. So let's say you've done your MRCP Part 1 and Part 2 written, and then you have the clinical exams. So the final chance to do it is the end of this year. So you will have the results of the clinical exams end of this year or very early next year. Then by the time of the interview, you should pass the exams, but you will be able to apply for the HST application, and you can be even as well shortlisted. So then the other requirement to be eligible for registration with the Irish Medical Council, to have proof of competency in the English language. And most of the time in the scenario, you already did IELTS test or OET years back, and you've been already in Ireland for a few years, and you've done your BST training. So the only requirement they will ask to prove that you've been working in HSE for all these years, and then you're going to provide your OET or IELTS test the previous, even if it was expired a few years. But the main requirements is that it should be valid by the time you start working here in Ireland. And then one of the main requirements, especially for the HST, is to show some commitment to the specialty and some experience in that, as well as, because it's very competitive, you have to have experience of research, audit, teaching, leadership, as well as management. Just to note that some specialty have additional entry criteria specific to the specialty, and you can find it on the RCPI website. Then, as Dr. Mohamed mentioned earlier, the Irish, if you have nationality Irish, UK, EU, and holders of Stanford or Stanford EU family, all of these have priority and treated equally in ranking. Then what are the practical tips for the HST preparation? So my advice will be start preparation and planning early. And I would say start planning from today. Sit your membership exams early, because this is most of the time is the struggling, and most of the scenario, as I mentioned, you will be finishing the BST and you're struggling to finish the membership exam, and then you will lose the chance to apply for the HST on time. So think early to finish the membership exams. And I know that it's sometimes difficult to choose what subspecialty in medicine, for example, or what specialty that you're going to be working for almost all life. But it's a priority that you have to think early, try to think what you prefer and what specialty you would like to do. Then if you choose what specialty early, then that will help you to plan ahead and to have a plan early how you're gonna get the high specialty training. Like, let's say you choose a specific specialty like rheumatology, for example, then you go to the RCPI website, and you just write the shortlisting and interview criteria for that specific specialty. And then you will find there are two criteria, which we're gonna mention it later in the next few slides, how to see how the scoring systems, and each specialty, sometimes they have higher mark on a specific thing, then you will know what to do in the next 1 or 2 years, for example. And then, as I mentioned earlier, you have to have specialty commitment, like, for example, having clinical experience. And I will give an example of my experience. Like in rheumatology, while I was in the BST training, there was no rheumatology rotation in my BST. So when I was doing in Sligo and then I was moving to Galway, I had to ask for the rheumatology rotation, and that helped very much. Especially, I did the rotation around April time, and actually the interview time was around end of February. So it helped me a lot, especially with the mock interview and all the tips that I will mention it later as well. And even if you don't have a specific your preferred specialty, you have to ask your colleagues to try to swap. And if you couldn't, still, if you're working in a hospital that containing that specialty, try in your free time. Even if you can ask permission from the team that to attend some clinics, show your face to the consultants. All the consultants on that specialty have to know you, and then because it will reflect very good in your in your genuine commitment to that specialty. And as well, even if you could, you can do like audits on that specialty. And as well as Dr. Mohamed mentioned earlier, you have to know what are the time of the national meetings or even international meeting of the specific specialty, and try your best, especially for the national meeting, to attend it. And it's usually once or twice a year, and show your face to the consultants. Even you can, it's an opportunity to meet the SPRs and ask them their experiences, and they will give you very good, and you can have their contacts, and they will help you a lot on that. As well, if you got a chance also as well to do researches, that will be, and publications will be very good in your for the application. And again, the network, and seek mentorship from consultant. Try to go to each consultant, even in your specialty. Ask each consultant an advice. I'm planning to apply for the HST. What's your advice? Let them read your CV to reflect on the CV and give you advice. And then you will have a conclusion from all the consultants, and then you will have a plan, and you will have a higher chance to get the HST. Again, to continue regarding the practical tips for the HST preparation, you have to strengthen your CV by, again, research, audits, publications, and oral and poster presentations are really important. Even if you've done any audits, try just to submit it, see what meeting fit that audit, try to submit it on time, and maybe you're going to get a poster or oral presentation. And if you got that, still try to do it as best as possible then, because at the end of the presentation, most of the time there will be awards, so you can get the best oral presentation awards or the best poster presentation, which will be very good in the CV, and that's what they're looking for as well regarding that. And then even if you couldn't find any possibility to present it nationally, still you can submit it. There's like a meeting, there's like sometime meeting in the specific hospital. You can try present it there, or even only on the ground round, or just locally with the team as well. You can mention it in the interview. And then regarding teaching, I know most of the doctors, they will mention that we have teaching experience, like with teaching the medical students and junior SHOs, but like to get a higher mark in the teaching, you need to design teaching yourself. Try to establish teaching in, like, let's say if you're working in a hospital, try to find a way that you can start some new teaching yourself, arrange it, organize it for the SHOs, or even for the junior intern. Like if it's regular, then if you're mentioning that, it would be a very good as well in your CV. And then regarding leadership, as Dr. Mohamed mentioned as well, try to participate in committees. There's many options to participate in committee. And as well, you can apply whenever you apply for a job from the start. Apply for the NCHD lead. Try to be in the NCHD lead, which is really good in the CV. And as well, if you're already in the BST training, try to be one of the BST representative in that hospital, if possible. Then management, try to, for example, if you're managing the roster, all these you can mention it. It will help in the CV. And then again, the postgraduate degrees, if you have a diploma, master, or PhD, that will be very nice in your CV. These are some examples of the shortlisting criteria. I mentioned it earlier. As you can see here, I just brought two examples for the rheumatology and the geriatric. So actually there are two criteria. There's the shortlisting criteria. So when you apply for the application, Then according to this criteria, they're going to shortlist you whether you're going to go ahead for the interview or not. So this is the criteria. Then the interview criteria, I will give an example later as well when we're speaking the interview. So here, as you can see, the one on the right side of the slides here, this is the HST, rheumatology, and the GIM criteria. As you can see, there's a difference here on the marking. It's a total 20, and academic achievement, even the undergraduate performance, or if you have any higher degree, scoring 5, then the research, application, audit, all 5, then the clinical practice, as I mentioned, the commitment, scoring 5, and then the leadership 2.5, and teaching as well 2.5. And in the other side here, the geriatric medicine, the scoring, the total 40, it's the same thing, just doubling, they're doubling the mark, so they have better option just for the scoring here. So professional qualification as well is the same thing, and the total is 40. So this will give you a very good how you're doing, and you can even guess what you're gonna get, or how are you doing with that. Then how you're gonna make your application stand out. So now you already plan for the HST, and then now this is the time to apply for the HST. So just to mention that HST is very competitive, and this is unfortunately due to very limited seats here in Ireland for each specialties. But the good thing that over the last few years, the number of seats are getting higher, which is a good thing. And then you have to be aware of the HST application opening time and try to apply early. So, for example, this year, the application opening date will be on the 1st of October, which is a good timing to plan it. And then the closing date on the 29th of October. So my advice for the application is to spend enough time filling and editing your application. And even if you spend enough time filling and editing your application, still after you finalize it, ask one of the specialty SPRs or even one of the consultants to review your applications, and definitely they're going to give you advice, and then you're going to edit again, and then try to maximize your effort on the application, because this is the main thing. And the shortlisting is the more difficult part, because if the application number are really high, usually they are shortlisting very specific number most of the time. According to the specialty, like let's say in rheumatology, they won't shortlist more than 13 or 15, even if the applicant more than 30, let's say. But in the interview, it's you will get a higher chance if you shortlisted. And then you have to secure your references, because it's mandatory, at least 2 references for the application. So now you started, you're planning to start the application, and what to expect when filling your HST application form. So the application form, you're going to find it on the RCPI portal. Then the first few questions, it will be about your personal details, contact information, professional qualifications, awards, medical counsel information, then this questions and declarations, and then again, as I mentioned, 2 referee details. And just regarding the referee, you have to make sure that you have a good referees, as now the reference will either they're going to email the consultant straight in their emails, and then they're going to give a feedback, or they're going to apply it online. So you won't have idea about what was your feedback. So then regarding, they will ask you about your employment history. Most of the time in my application, there were maximum of 8 posts. So just the previous 8 posts is not like since graduation. Then there will be questions about publications. Then they will be asking about publication time and the journal, and as well the author status, whether you're the first or co-authors, or the what's your status, and then as well the present, and whether is it national, international, or regional. Then here, still, this is the main part of the application. And when I mentioned earlier to spend enough time in writing the application, is actually because of that. This is, for example, in my application, but I think most of the other specialties, they have the same idea of that. You have to write 500 characters for each of the following, and this is exactly what was in my application form. So the first question, if successful in your application, what are your aims and career objectives? So you have to specify what's your aim and career objectives, and then they will have idea about your what's your aims and a bit of your like your character, how is it. So you have to spend very, very good time on that. Then the academic achievements, research experience, audit experience, clinical experience, demonstrating interest in the specialty, then laboratory experience, if applicable, like let's say in pathology or hematology, and then leadership and management experience, and then teaching experience. All of these you have to write around 500 characters, and these are the main part of the application. Then the next, sorry, here, this is the last part of what you're going to expect when filling your HST application form. The last thing, they're going to ask you to upload your documents. Then, as I mentioned, if you already you already completed your BST last July, let's say, or even before that, then you're going to submit your BST completion certificate. But if you're already on the second year of the BST, and then you are planning to apply now, then you're gonna just submit your BST contract, the 2-year contract, and then that's proving that you're still on the BST. And then all qualifications that you mentioned earlier, you're gonna submit proof of qualifications, then your national passport copy, a proof of the English language competency, proof of your Irish Medical Council registration, and then if you have a stamp for, then you can apply it, or even if you have the Irish passport, then a copy of updated CV, it's preferable, and sometimes, yeah, it's mandatory, but in my application, I haven't submitted because it's already all mentioned in the previous questions, and there was no issue with that. Then the next part, after you submitted your application, and then what are the keys to a successful HST interview? So the shortlisting outcome, so you're going to expect an email from the RCPI by the end of November, early December time. Some specialties may vary. And then my advice, even before getting the shortlisting outcome email, try to practice early. And my advice is to continue practicing, especially for the interview skills. And my advice, either to ask one of your senior colleagues like SPRs or consultants to work on your interview skills, and you recommended as well. If you, I found these really helpful, even from feedback from other SPRs that successfully got the HST job. So these are two examples, the I4 training and also info@learconsulting.com. These are two coaches are really good in the interview skills, especially if you already prepared, then they're going to give you very good insights for your interview skills. And one of the things I need to mention, if you plan to book an appointment with them, it's really hard to get, and most of the time, even if you contacted today, sometimes it's already for the next few weeks or month already full. So try to apply for them early. Sometimes it's a bit expensive, but you can apply through the TSS, and then you can get your money back. Then as well, just to mention, also you can read some interview skills book. I found that was very helpful. The ISC Medical Interview Skills Consulting Guide to CT, ST, and Registrar Interview. Actually, it was really helpful. And then you have to know the system, like the HST structure, the training pathway of your specialty that you choose. To read, there's actually, when you go to the RCPI website, you can check the curriculum. There is a curriculum for each specialty. If you read it, you have to read it all, then you will have a good chance. You have a better idea about the training pathway, and this will help you a lot. And then as well as the consultant role. And then the mock interviews, again, Even as I mentioned, the interview sometime most of the time will be by February or March time. Then if you already prepared, then ask the consultant and SPR, as I mentioned, to do mock interviews, even with the time, by the time, and it's usually like around 20 minutes, and this will help you a lot in the preparation. These, again, examples of the interview scoring for rheumatology and geriatric. And the one on the right here, this is the HST rheumatology one. And as you can see, it's different from the previous shortlisting one. This after the interview. So you're going to be scored from 20 for your CV and career to date. And then the research publication, and as well, including here the audits as well. Then future plans, career, then knowledge of specialty, interview performance, and professionalism. And the GIM question 10. And actually, because these, if you're doing the dual certificate, like let's say rheumatology and GIM, then you're going to have some few questions, GIM questions. So that's why they're scoring 10. And then the other side here, the geriatric medicine HST interview criteria here. So the interview performance and professionalism actually 40, then the clinical experience 20, management, leadership, teaching all 20, and then the research audit 20. So each specialty is different. Then after at the moment we have a good idea about the HST applications and the HST interview. So what to expect on the day of your HST interview? So all HST interview in person, and most of the time it will be on the RCPI building in Dublin. And then the interview date, as I mentioned, in February, early March. The interview panel actually, there will be most of the time 7 to 9 consultants, maybe more, and including at least one GIM consultant for dual specialty. As I mentioned, the interview time about 20 minutes. And common questions in the interview, most time, the first question will be talk about your CV. And I will stress on that questions, actually. You have to spend more than enough time knowing what to say on that question, because this will give the first impression about for all the consultants. So you have to know what to say and the time that you're going to finish answering that questions, and asking again SPRs or consultants to have feedback about that. Then then the usual question will be talk about your presentation, teaching, audits, research experience, each consultant. Then they will be moving, asking, one consultant will ask you, talk about your presentation, then teaching, then audits, research experience, and then they can ask you as well, like give examples for your leadership and management experiences. Then questions relevant to specialties. Each specialty, they have different questions, and as well GIM related question. And so my practical advice is for the HST interview day. My advice that try to arrive early for the day, dress professionally, stay calm. So think before answering. I know it will be a very stressful day. Then listen carefully, show enthusiasm and genuine interest in the specialty. And then end strong, thank the panel, show gratitude, and reaffirm commitment. So here, this is the last part here. Key points to remember. Getting an SPR position is the final standard route to become a consultant in Ireland. Start early, membership exams, audits, teaching, and research. Build over time. Don't leave them to the last minute. Be strategic. Tailor your portfolio and experiences to the specialty you want. Show commitment, specialty-related projects, mentorship, and networking make you stand out. Prepare and prepare. Know your CV inside out. Practice interviews and anticipate common questions. Stay resilient. The HST process is competitive, but many succeed after persistence and planning. As Sudanese doctors in Ireland, we bring resilience and unique strength to the system. These are real assets when applying for the HST and beyond. Thank you all for listening, and I would love to hear your questions and reflection. Thank you very much. Understood.
Thank you, Mohamed, for this very comprehensive and very informative talk. So after she's going through the journey again of becoming a specialist practicing as a consultant physicians in Ireland. So after completing your BST and your higher specialty training, obviously the next step you want to apply to a consultant post in Ireland. Obviously, completing your HST and BSc doesn't mean automatically that you're gonna get a consultant post in Ireland. It's very competitive. There's limited posts. So obviously, after finishing your higher specialty training, you want to stand out. You want to compete for a consultant post, and you want to be successful in getting that post. Most people, after finishing their high specialty trainings, they do kind of fellowship or higher further trainings in the subspecialties that they're interested in. So this is obviously you can do that fellowship training either in Ireland or outside Ireland, but just to let you know, there is post CSCST fellowships post here in Ireland governed by the RCPI. So these fellowships are designed for doctors who need to acquire additional training or experience that wasn't available during their higher specialty training. For example, if you want to do a stroke medicine, work as a stroke medicine consultant, you need to do a fellowship in stroke medicine. If you want to work, for example, in respiratory as a lung transplant physician, you need to have a transplant experience, a fellowship prior to applying and compete and acquiring that post. So in association with the HST, the RCPI has established a register of approved post-CCST fellowship posts in Ireland. These fellowship posts offer the training opportunities for doctors who are within 2 years of completing their HST programs and obtaining their CSCST. Obviously, you need to think about this from your third year of training and even earlier, where you're going to do your fellowship training with who, and you need to start the process early in your higher specialty trainings. And because you need to apply for this post and get it within 2 years of completing your CSCST. It's an additional training, as I said, designed to expose you to subspecialties and advanced clinical skill. So what it is, it's a 12 years program of additional training beyond your higher specialty training. The post will offer you a structured educational experience designed to deliver the requirement of a particular subspecialties. You'll have a supervisors with authority and accountability to the fellowship post. You'll have opportunities to perform few audits and research in your area of interest. And all these posts are recruited, evaluated, and approved by the RCPI. Who's eligible? As I said, you have to have successfully completed your RCPI higher specialty training program within 2 years of applying. You have to do your and the post-CCST fellowships are ordinarily for 1 year, but you can do it over 2 years. And usually it's in one hospital, but you can do it in multiple training sites. And as I said, it's approved by the HSE NDTP. So going again, API structured training post, or you can apply to register as a specialist in Ireland through the competent authority routes or the credential routes, or the alternative pathway. I will hand you over now to my colleague, Dr. AlaEldin Muhammad Ali, consultant, physician in nephrology and general internal medicine in DSA Hospital in Northern Ireland. So Dr. Ala graduated from University of Khartoum, Sudan, where he worked for a few years as a registrar in medicine before moving to Ireland in 2019. In Ireland, he rotated across different specialties in medicine, finally focused on nephrology, where he worked as a nephrology registrar in Cork University Hospital for 3 years. and moved to Dublin, working as a nephrology registrar in multiple major teaching hospitals, including Tala, St. Vincent, and Bond Hospital. As I said, he's currently working as a consultant physician nephrologist in Daisy Hill Hospital in Northern Ireland. So, Ala, the floor is yours.
Yes, hello, how are you? Good afternoon, everyone. Assalamu alaikum, and thank you so much, Hisham, for this introduction, and thank you also for the SDUI for having me today, and for everyone who's attending, and you're all welcome, and I hope you'll find my presentation useful and helpful to get you onto the specialty registration. I don't know if you can.
You can share the slides, Ala.
I see if I can share my own slides or.
So at the bottom, share, green.
Yeah.
Share and then share your.
So, entire screen. Okay.
Excellent.
Can you see it now? Or?
Yes, you can see your. Yeah, you can open your. You can see your screen now. You can open your talk and.
Okay. So, so first of all, thank you for the previous speakers. I think they've gone through the BST, the highest specialist training pathways, and in a lot of details. Just see if I can. Sorry, I can see my slides here. Can everyone see my slides? I don't know if you can see my slides here or not.
You can see the screen, but not the slides. Go to share again and just share exactly the slides. Do you have it open?
I have it open, yeah.
Go to sharing again.
1 second. Okay, let me start the presentation. Sorry. Okay, 1 second. So share screen.
Select the PowerPoint and then double click on it. Excellent. Now we can see it, yeah?
You can see that now, yeah?
Yes, thank you.
All right, okay. So, so the first thing I would like to say, I'm going to talk about, the alternative pathway, and what we mean by the alternative pathway for those who couldn't get, to succeed to get into the specialty training, the training pathways, because as we all know, and as mentioned before, it's a bit competitive sometimes, and not everyone can get into the training pathway. So for those who are not successful, so we will say, don't worry and don't panic. It's still possible, still doable. You can do it, but it might be a bit more, harder to do it. It needs more effort and more to work hard to do it, and it might be a bit of, time consuming and taking longer than you expect, but still doable. So can we go to the next slide, or how? Okay, so
you need to open it in PowerPoint or down.
It is in PowerPoint, yeah. So so an overview, like enter requirements, as my previous speakers, the previous speaker mentioned, it's the same like the entering into the specialty training pathway. So whatever the trainees are doing, you probably need to follow what they do and do the same, but you are going to do it yourself. You don't have a portal or like a structured pathway that you can follow when you're in the trainee pathway. The duration and the rotation are equal. You know, you need between 4 to 6 years, maybe longer than that because of certain circumstances. And then clinical activities procedure will be the same as mentioned before. Education activities, teaching, research, and audits are very important, and they will, if you do as much as researches and audits and publication, they will be very helpful and augment your application at the end of the pathway. Professional development, through the RCPI. So if you do that every year, and you have a document of that, and then I'm going to talk about an application process and give you a bit of advice on how to do your application.
Ala, I can't see the slides.
You can't see the slide.
Is it just me, or can you see a slide, guys?
No, we can't see it. Just if you open it again and maximize the screen, then and you can move.
Yeah.
Okay.
So stop the sharing and then just share again. Share the PowerPoint slides.
Sorry, I am bad in technology thing, you know. So
that's all right. We're all learning.
Okay, take your time.
You know, so entire screen sharing.
Okay, now you can open the PowerPoint.
No.
Yeah.
Okay.
Yeah.
No. All right.
Excellent.
Okay.
Thank you.
So training duration, like as the colleagues mentioned, the basic special training is 2 years. So if I think now most of the jobs now for the SHOs are like BST recognized jobs, but sometimes if you're doing a standalone SHO, so you need to do 2 years equivalent, and then they will ask you for an evidence that you have done an equivalent BST certificate. It will be the same, you know, if you do different rotations in different hospitals, like 6 months, between 3 to 6 months, as mentioned before, and you need to present an evidence of that by completing the performer that they will send you when I'll show on the application package. And then we're going to hire specialty training or equivalent. It will be between 4 and 6 years, as mentioned before. Might take you longer, as in my case, because you'd be looking for the jobs yourself. You don't have as the SPR, so they know where they're going. Their jobs are already, you know, planned before by the training body. But for yourself, as standalone, you have to compete for the jobs and you have to apply for the jobs that's are recognizable and required for the criteria for specialist registration. So I give you an example of myself. I started doing my registrar job in Galway, and I did 2 years, and then after 2 years, as mentioned before, they will not recognize more than 2 years in one hospital. So I started applying for moving to Dublin, specialty women hospital, to do a transplant job, and it's extremely competitive. So I applied. I didn't get the job. This is the difference, because, you know, the SPRs, they know when they're going to do the job in Beaumont, and everything is clear and straightforward. And then, so I have to apply 3 or 4 times to get the job that's, you know, needed to fulfill. So it takes a bit of longer time, but the basic, you know, requirement of between 4 to 6 years. Then in medicine, generally, the core rotations between acute medicine, cardiology, respiratory, gastroenterology, endocrinology, different specialties, as mentioned before. So you have to try and get into these specialties. And then if you're targeting a subspecialty, specific specialty, you need to look into that and talk to the consultants and to the, you know, hospital managers or whatever, to get yourself into that job, like for hematology or nephrology. And then you have to have your MRCP-I or MRCP-UK or equivalent, exams done. Logbook, you have to create your own logbook here, or try and get a way of recording your activities, your clinical activities, or procedures or everything. And then audits, quality improvement projects, research publications, and teaching experience are all very important to support you throughout your pathway. And so for higher specialty training in nephrology, it's minimum is 4 years, and maybe you can do 1 year in research possible. And then dual specialty, you need 5 years. 1 year will be in general internal medicine. It's delivered by the RCPI, the medical higher medical training body. That's kind of like the so that's the assessment at the end of the period, and it's approved pathway by the medical council, and SPR or registrar posts in approved teaching hospital, and maximum 2 years in the same hospital, as I said before. It was 1 year the same trainer. So you cannot do when you're completing your application forms for the post, you have to get 2 different trainers to sign your posts. So I think we've gone through this before, my colleagues. So entry requirements. So I'm going to go into these details because already mentioned in the previous talks. So for nephrology, for example, you need per 1 year at least like more than 40 outpatient clinics. Hemodialysis more than 10 per year review, protein dialysis more than 10 per year, chronic transplant more than 20, ward round, either led ward round or registrar-led ward rounds. So all these you have to then present an evidence of you've done that, and this will come. You can do that when you complete your post summary forms and the reference forms, which I'm going to show you later. Then practical skills, they're not all in nephrology, for example, required, but they're desirable, like renal biopsy, vascular access, renal ultrasound, peritoneal dialysis, catheter insertion, and urine examination, and other practical and procedures. Also, educational activities. The most important are, I highlighted that in bold here, are the mandatory courses like ACLS, ethics, research methods, leadership, communication course, audit, performing an audit, wellness matters. That's for nephrology. I think for general medicine, you need to add the stroke course, the NHSS. And then in-house in each hospital, you need to provide an evidence that there is a grand rounds, MDTs, general clubs, everything that's going through your job. You have to record that and make sure it's mentioned. ASN exams, if you do an extra exams as well, will help you get into the specialty registration. Teaching as well, get any chance to get in a teaching post, That will be very helpful. Or if you're doing teaching during your job, the registrar, for example, teaching students or junior doctors, you have to mention that and record that in your e-portfolio or in your, and you have to state that in your application. Performing an audit, we mentioned that, publications as much as you can, and do a lot of presentation and attendance of meetings, other national and international meetings. And it's very important, networking and showing your face in these meetings, and presenting yourself to the different consultants as much as you can. Meeting attendance, like 1 per year, if you can. Sometimes can be difficult to attend certain meetings, like the study days or things like that, because you're not on a training post, so you have to try and squeeze yourself in between your jobs to do some of these meetings. And then so general medicine, again, I think it's been mentioned before. So the duration 4 years in a supervised post, 1 year maybe full-time research. The post must be more than 3 months and less than 2 years, and maximum 2 years in the same hospital, 1 year with the same trainer as per nephrology. The same things here, the usual things they do: ward rounds, consultant-led or registrar-led, SPR-led consultation. ICU, CCU experience are required for medicine and outpatient clinics. And then the procedure for general medicine are different from nephrology, like abdominal paracentesis, lumbar punctures, pleural aspiration, joint aspiration, central lines, cardioversion, BiPAP, CPAP, ECG, echo, and intercostal drain insertion, or any other procedure that you know. So the more you do, the better you get into the the recognition. And then the courses, they're almost the same, and except I think we're adding the NIHSS for the stroke for medicine. Teaching, we mentioned that before. Research, audit, publications, professional development, you do that every year. So now we're going to go through this in a bit more attention, I think, because this is the most important part of things in order to get you into the specialty registration. So the application process is a prolonged process, and it's time consuming, a lot of documentation and paperwork needed. The idea is you're trying to convince the assessing body that, or the RCPI and the medical council, that you fulfill the criteria and you're qualified to be a consultant or to get the specialist registration, as the other, the trainees or the training trained doctor through the training pathway have done the same things. So in order to do that, there's a package, they will send it, and the package has a very clear and very helpful instructions that you can follow, and you need to follow it step by step. So initially, you need to read the criteria stated by the assessment body, like the RCPI or the medical council, and make sure that your pathway, what you have done, is equivalent or fulfilling these criteria. Then you need to make sure that to assemble your documents to support your application, and this document must be prepared correctly on an A4 paper, single-sided and ready for scanning, because it will be easy for the assessment, well, your application will go to the medical council first, and then the medical council has a triage people who look into the application, and they will check that the application is, is complete, and then so it will be easy for them to do. So if you do it in a very structured and clear way, it will make things easy for the assessment people and the triad people to go forward and do it. And then there's a specialty checklist on the application. So you have to complete that checklist and make sure all the required documents are there and in the same order that's required. And you have to complete a structured CV. So the CV, you can't use your own CV that you've done before. So you have to fill in or complete the pro forma CV that they send you on the package. And then you need to make sure that the post-health forms, either for the BST or HST or equivalent, are printed and stamped and typed. They must be typed. They always say that, and you have to type them. And then they will send you an audit report forms, and you have to complete that forms as well, type them for each audit you've done. And then you need to then place your application in the application divider. So they send you a divider package, which, to organize your application. So you need to make sure and carefully put each and every document in the section that's on the divider. You have to complete also a personal statement at the front of the divider. So you have to write a very good statement indicating your experience, your training pathway, and what you've done throughout your training. And then, as I said before, you complete the application builder pack checklist, and you need to submit an application form. And for the alternative pathway, it's a specific application form called Category E form, which will come with the application package. And then you prepare your folder and make sure everything is in that folder, and then send it by post only, and you send it by registered post. So it's kind of, the most important thing is you start this process as early as possible. And if you start as you go, will make things more easier and will save you a lot of time and hassle, because as we know here, we rotate frequently between different hospitals. And then if you start late after you finish, and then you're ready for applying now, and then you have to go back retrospectively to go to previous hospitals, and you'll be traveling from between different hospitals to get your forms signed and stamped and completed. So if you can do it as you go, it will be very useful and will save you a lot of time. So I just going to go through the application builder pack. So the application builder pack is made to assist in preparing your application in a structured manner. And if the application pack is not completed exactly as prescribed format, they may return it back to you, and that is going to be another time-consuming issue, and will take time to get back and forward and forth. So all must be like typed A4 and single-sided, all the documents. And there's 18 separators in this in the builder back. So the folder has 18 separators. So see, it's kind of a big folder at the end. So from the CV, qualifications, training, logbooks, audits, etc. So you have to put each of these in a separate folder. And then the references, the reference forms. This, I highlighted this as well in bold because this is very important. So they require 5 referee forms, and they have to be signed and stamped by the consultants, and then they have to be put in a sealed envelope. So the sealed envelope and signed and on the seal and stamped. So so the references, you cannot do them, you can do them after each job, and then you ask your consultant to do it. And then you have to be strictly compliant with the checklist. So you have the checklist, and then you go checking everything according to the checklist. And obviously, if you don't comply with all this, guidance and advice, you might get your application rejected or returned to you back to complete things. I think I've gone through this before. Yeah, I think this is the same. So so the folder will be in exactly this sequence. So the first page will be your application form completed. The second page will be second divider will be checklist, then followed by the CV, post health forms, evidence of BST or equivalent. In the alternative pathway will be the equivalent form, and it's a specific form for that. And then evidence of higher special training or equivalent. So if you're doing a standalone registrar job posts, so you have to fill in and complete the forms accordingly. Training assessment methods, either like if you have your own e-portfolio, you have the professional competence certificate for every year. The references, you can use them as a training assessment forms because they're signed and stamped by consultants. Logbooks, as I said, and record of every and each activity you have done. Experience content, which can be on your CV and in your post summary forms. And so there's a separator for CPDs and continuous professional development, research and publications, separator management and training experience, audits, report forms are very important, mandatory courses, extremely important, and then the last one will be miscellaneous. Any other extra qualifications, extra like other references, like for example, if you work with more than 5 consultants, definitely it will be, most of us will work, so you can get as much as you can from other consultant references, or whatever else you've done, you can add it into the last separator. So so the process is a kind of, it's possible, it's doable, and everyone can do it, but it needs to be, you need to work extra harder than the than the trainees, because you need to do all these things yourself. And but so my advice will be, everyone should try and get into the training post, which will be easy and save you a lot of hassle and time. But if you if you're not successful, so you can do it the alternative pathway. I don't know if I can show this. Can you see my screen now?
No, we can see the screen now, yeah?
Yeah. So this is the registration package that you. So if you ask for the medical consultant sends it for you, it will contain all these different forms, and then you need to follow their guidance. And all right, I think I'll stop here, and I hope this will be of assistance to guide you guys to start your application for CST. Thank you.
Thank you, Ala, again for this excellent talk. We tried to simplify a very complicated issue. I just want to reiterate one thing, as Ala said, try to record your activities as you go. Don't wait for 5 or 6 years and then try to apply for specialist registration so that the credential road or the competent authority road is going to be overwhelming and very time consuming. So just do it hand in hand. So do your application for the higher specialist training while simultaneously try to record your activities as you go, trying to go familiarize yourself with the applications for the credential road pathway, what you need, your logbook, and fill it out as you go every year. Get your trainer or your supervisors to sign you off, because by the end of the 5 or 6 years, you'll have your logbook ready and for submissions. And if you get your HST training, obviously that'll make your life easier. It's a structured pathway. You don't need to record anything. You just need to fill out your logbook by the end of the year and get your trainer to sign you off. I think we will wrap up. We'll just have a look if there's any questions in the chat. I think the guys already addressed some of these questions. There was a question about if the GPA equivalent to the rank. Mohamed Elhafiz, you want to take that question?
Yeah, so it's not exactly the same, it's different. The centile means which position do you take within the class. So either you're in the first 10% or you're in the next 10 to 20%, and that goes on. And the GPA is usually out of a specific point, out of a 4, for example. So most of the class could be within the range of 3.5 to 4 or below that. So it doesn't really, it's a different way of evaluating. So you have to go back to your university and contact them and try to get a centile for your position within the class.
Thank you, Mohamed. There's another question. I can see you already addressed that question, Mohamed Eltahir. Where can I apply for the HST application? So Mohamed already answered those questions. You can find it in the RCPI website through the online portal. You want to add anything, Mohamed Eltahir?
No, actually, yeah, that's just through the RCPI website, yeah. And then it's the same like in the BST application, the same idea.
Excellent, thank you. And then Ahmed, questions to Dr. AlaEldin. There's a common question from medical leads who are recently joined the Irish healthcare system. Is the alternative pathway well recognized in the Gulf countries? Do you need more years in experience as a consultant post-registrar by alternative pathway, or is it the same years? Either you registered through the alternative pathway or the formal CST pathway. Ala, I think the question,
yeah.
Samara, the question is asking, is it recognized in the Gulf countries, and is it you need the same amount of years, or you need more years?
Yes, it is obviously yes, because it is, you know, the end result of the alternative pathway is you're going to get your CST, which is a, you know, you're going to be getting to the specialist registration. You get a certificate, which is recognized. It's from the Irish Medical Council. It's equivalent to, you know, the other pathway. So it's the same qualification. So you'll be recognized everywhere. It's internationally recognized. So you can work in the UK, in the Gulf with this, you know, other consultant, you know, in Australia. Yeah, absolutely. Thank you.
Yeah, thank you, Ala. And there's another questions. Many colleagues refer to leave Ireland and move to UK to join the NHS after the completing the BST training. Obviously, you can try and apply here and apply in UK. Just try to kind of have multiple options. Sometimes things doesn't go as planned. If you manage to get your HST training here in Ireland, well and good. At the same time, you can apply to UK. The opportunity is definitely more in UK. UK is a big country compared to Ireland. There's very limited posts here. The posts are much more obviously in UK, but do it simultaneously, like, and apply in UK. Try to do your registration to the IMC and apply wherever you get your training.
Yes. Well, I just want to mention something. Yes, you're right, Hisham. The chances are more in the UK because it's bigger and they have more, and then you can get into the training. But you know, the same as here, the training takes, you know, the same thing. So you're going to go through the, you know, after the foundation year, you're going to foundation year 1 or 2, and then IMT, and then ST 1 to 7 or 6. So it's still also time consuming, and you need to work hard to get into the specialist registration. The thing that I don't know, I work in the UK now, and I get trainees from, you know, F1, F2 GB trainees under my supervision. So the training, I think training here in Ireland is much better than training in the UK. So you work hard here. So as an asset intern or SHO or a registrar, the jobs here are very busy, and you do a lot of things that they don't do over there. So we do clinics as interns here. We do clinics as an SHO. We do a lot of procedures, you know. So in the UK, they don't do much, you know. The registrars, sometimes they have their own clinic sometimes, but they don't do as much as we do here. I think training here the jobs are more tough and more busy, but I think training here, this is my own opinion. I'm not sure about other experiences.
No, I completely agree. Like, one of the strengths of the Irish training system is, yes, it's a national program and the generalism in it. So you'll get the experience. For example, in my specialty respiratory, you'll rotate through different specialties in different counties, different hospitals. You'll go through all the subspecialties in respiratory medicine. So there's very structured programs. In UK, it's regional training. Not to downplay the training in UK, but it's regional training. You work in one hospital, most of your training, and obviously the region, they will have certain subspecialty that they focus on, but you don't have a good exposure to other subspecialties like here in Ireland. It's a national programs, and they do look after their trainees. They, like, you'll meet with your trainer regularly every 3 months with the national specialty director, and they will, like, try to structure the program focusing on the subspecialty that you have interested on. So, and it's very busy system here. Like during my first year in the HST, I filled out all the requirements, the logbook requirements for all the procedures in 1 year. All the procedures that I need to complete throughout the training, it's in 1 year, so I filled it out. So it's a busy, and it's a very good program here if you get it. But obviously, like, apply here, apply there, like wherever you get it. you can go and pursue your training. The question again, does all the specialties have alternative pathway? As far as I know, yes. It's the same criteria applied for all the 19 different specialties in internal medicine and the subdivision under the Institute of Medicine. You can apply to these through alternative pathway. But it's not a straightforward procedure, the alternative pathway. I know Allah trying to simplify things, but it's very complex. And as Allah mentioned, so obviously your training, you need to do your own training. You need to structure your own training. You need to get exposure to very difficult jobs that you won't easy get unless you're in a training post. For example, he mentioned that the transplants. So they reserve the transplant registrar post for the SPR trainee, and as a standalone post, it's difficult to get that post. As he mentioned, he applied 3 or 4 years till he managed to get that post. So it would take you much longer.
Absolutely, Hisham. Yes, it is. It's not as simple as I try to just summarize it, but it's not simple. You need to work really hard and harder than than you expect to get into the specialty training. But the simple thing I said, if you do what exactly what the trainees do, so you'll be qualified because you fill in the criteria, you fulfill the criteria. But it's not that easy to do it because you have to do it yourself and you have to look for jobs and you have to compete with the trainees. And we know the competition is high in Ireland because the posts are limited and the hospitals are limited, and they have they prioritize the SPRs and the specialty trainees. They prioritize the EU or the Irish and the EU citizenship. So it's not easy. It is hard, but it's still doable, and you can do it. You need to just to start right, start earlier. Start if you start from the beginning and start and complete things as you go. So don't leave things to the end of your time, and then just make sure you check every time the requirements and you go through the checklist and everything every time, and then try and fulfill this because that will save you a lot of time and a lot of hassle.
Thank you, Ala. There's another. What about hematology? You said it doesn't need a BST training. How can I apply for? I don't know. I'm not sure if you need a BST training for the hematology or not. Mohamed Eltahir, do you wanna take that question?
Actually, as far as I know, and according to I was just checking now the RCPI website, and as far as I know, the BST is one of the requirements. So you need to do the 2-year BST, then you can apply for the hematology.
There's another question. So what helps most in the HST application? That's a difficult question.
Yeah, actually, it's a difficult question because the HST application is not about one thing you need just to focus on. It's about you have to balance yourself. And as I mentioned, as you can see from the presentation, the scoring system involving like different aspects, you have to, my advice will say the best thing that will help most in the HST application, planning early and try to maximize your achievements in all the domains like research, audits, experience, teaching, leadership, management. Try to see yourself like what you can do in a specific like here and plan early and do as much as possible, and that would help. And the other thing I need to mention, the networking. The consultants have to know you, and then and that would help very much.
Yeah, obviously you need that's the talk. What helps most in the HST application. There's no one thing that will help you in the HST application. It's just you need to go through the requirements and need to kind of tick all the boxes and make sure you're one step ahead of everyone else applying. As an international medical graduate, you don't have the same chance as kind of Irish graduates in the applications or in the interview. So you need to be one step ahead of everyone when you apply. to make sure you get the post. And also try to work in major hospitals where you work with the people who you will find in the interview panel. Like, it make a big difference if you go to the interview panel knowing 2 or 3 from the panel that you work under their care, so they will kind of back you up in the interview process. It's difficult that you haven't worked with in any major hospital with any of the kind of national affiliate directors and go into the interview. It's not easy to get the job. So try to work in big hospitals, major hospital, with influential people who they will help you because the interview takes like most of the scores, a lot of the scores, the final scores will be in the interview. So, and it's difficult to impress like 20 consultant in 20 minutes. It's difficult for them. Like, if they have their candidate who work under their care, they know hard worker, work under their care, they know him well, to choose you and not him. So avoid the kind of peripheral hospitals if you are trying to apply for the specialty training. There's a question for you again, Mohamed Eltahir. Do you want to take that one?
Yeah, so the question is, doing a postgraduate diploma or master's would help you to stand out and guarantee an HST post? Or in other words, is it worth it to do a master or diploma to help you compete? Keep in mind the financial implication, the mental and physical efforts associated with doing a postgraduate master or diploma. Yeah, so I understand, yeah, this question, and again, as you can see, if you check most of the shortlisting criteria, the postgraduate diploma, it's usually they are scoring it not more than 5 or 10, and even the postgraduate diploma was the this is I'm talking about the shortlisting criteria first for the application. So the postgraduate diploma and with the pre-graduate even achievement, all these will be 5, 10 maximum, but it will help better if you've been already shortlisted, and then it will be good to compete during the interview process. So with the interview, I think there will be higher mark for it. And as you can see, the CV usually 20, 30, 40, sometimes they are scoring. So sometimes it's more subjective thing, but still it will stand you out anyway. So it will be good to have it. But if you're gonna do the diploma and then you're gonna delay yourself doing the essential thing, like let's say the membership exam, so I would say finish the exam first, then go ahead with that. So try to know what you're able to do and then plan it. Yeah.
Well said. There's one final question. I came into the SMBC IMGNT. Now I'm doing the second year. I heard that after completing these 2 years, I'll be offered the BST certificate. I don't know the question. Anyone have any idea? Anyone attending today has any idea? So I will pass that questions to SDUI and they'll get back to you. I don't know. I think we probably passed our time by almost half an hour. I thank you all the speakers for this very fantastic talk, very comprehensive talk. And thank you to SDI for organizing this. So one final thing, the SDI, there's a link sent here by the host. If you want to claim your CPD certificate, your points, just fill out the survey and you get your CPD certificates.
Yeah, so
I'm not sure if the host want to add anything.
One thing, Hisham, before we go. So we'll be here. You know, we're very happy to take any questions, like any calls, if anyone needs an assistant in completing their application. So because I've done this and I have the package and everything, so everyone needs help or have any question about how to apply for the alternative pathway, can give me a call or an email anytime. I'm happy to give advice as well. I know. Okay.
Excellent. Thanks, Anna. And I have my email as well. If anyone has any question, I'm happy to answer it, or if anyone want to approach me, I'm happy to help. If it's very difficult to cover everything in 1.5 hours, but everyone is willing to help. So just reach out. We will help if we can. I think I'll close the session if the host doesn't have anything to add. Yeah.
Yeah, thank you.
That's it. All right. Thanks for your time.
Yeah,
Thanks,
thank you very
everyone.
much.
Bye.